You take your vitamins every single morning. You eat your vegetables. You have not touched fast food in years. And yet you are still tired by 2 in the afternoon. You still lose your train of thought mid-sentence, and your hands have started tingling in a way you cannot explain. Here is the part almost nobody tells you. Doing everything right can still leave you dangerously low in one specific nutrient, and the reason has nothing to do with your diet at all. This is not about willpower. This is not about eating better. There is a mechanism happening quietly inside your body after age 60 that no amount of healthy eating can fix on its own, and by the end of this video, you will know exactly what it is, exactly what to ask your doctor for, and exactly how to fix it. I want to walk you through 4 signals I see missed constantly in patients over 60. The first is fatigue that sleep does not fix, the kind where you wake up already tired. The second is a kind of mental fog, misplacing words, losing your train of thought, feeling a half step behind your own conversations. The third is tingling or numbness, usually starting in the feet, often worse at night. And the fourth is a subtle change in balance, a slight unsteadiness that was not there a few years ago. Individually, each of these gets dismissed as normal aging almost every time. Together, they tell a very different story, and by the end of this video, you will understand exactly why. Before we go further, I want to invite you to be part of something. Every single person who joins this channel helps me understand which topics matter most to people your age, and that shapes what I make next. If any part of this video helps you today, consider joining our community here on the channel. It costs nothing, and it genuinely helps more people find information that could change how they age. By the way, my name is Dr. Matthew Clark. I am an internal medicine and preventive health physician, and for the past 15 years, I have worked almost exclusively with men and women over 50 who want to catch problems before they become emergencies. I did not become a doctor to hand out prescriptions after something already went wrong. I became a doctor to be the person who tells you in time. And this topic is one of the clearest examples I know of something going wrong quietly, underneath a life that looks completely healthy from the outside. I have sat across from patients who did everything a good doctor would tell them to do, and still ended up sitting in my office wondering why their body was not cooperating with all that effort. This video exists so that fewer people have to reach that point before getting an answer. Let me ask you something before we go any further. Has this ever happened to you? You walk into a room and forget why you went in there. You reach for a word mid-sentence and it simply is not there anymore. Your feet feel slightly numb in the morning, or your balance feels just a little bit off when you stand up too fast. And every time, you or someone around you says the same thing. That is just getting older. If any of that sounds familiar, I want you to keep listening, because what I am about to explain is one of the most consistently missed diagnoses in adults over 60, and the tragedy is that it is almost completely reversible if it is caught early enough. I would genuinely like to know, has this happened to you? The tiredness that sleep does not seem to touch? The moments where a word simply will not come? Or that small unsteadiness that was not there a few years back? Drop a simple yes in the comments if any of it sounds like your own life, because it will help you as much as it helps me to know how many people are recognizing themselves in this right now. The nutrient we are talking about is vitamin B12. I know that name might sound familiar to you already, maybe from a multivitamin label or an energy shot at the pharmacy counter, but I want you to forget the marketing for a moment, because what B12 actually does inside your body is far more serious than an energy boost. Vitamin B12 does 2 critical jobs. The first is protecting the coating around your nerves, something called the myelin sheath, which works a lot like the plastic insulation around an electrical wire. When that insulation is intact, signals travel fast and clean from your brain to your hands and feet. When it starts breaking down, those signals slow, misfire, or scatter, and that is where numbness, tingling, and balance problems begin. The second job is helping your bone marrow build healthy red blood cells. Without enough B12, your body still tries to make those cells, but they come out larger than normal and less able to carry oxygen efficiently, which is a major reason behind the deep, unexplained fatigue so many people over 60 simply accept as normal. I want you to do something with me right now, wherever you are watching this. Hold out one hand and gently press your fingertip against your thumb, one at a time, as fast as you comfortably can. If that feels smooth and coordinated, good. If it feels the slightest bit clumsy or delayed, or if you noticed any tingling while you did it, do not panic, but do keep that observation in the back of your mind, because we are going to come back to it later in this video. This exact test takes physicians only a few seconds in an office visit, and yet it rarely comes up unless someone is already being evaluated for a nerve-related problem, which means most people never think to try it on their own. Here is the myth I want to dismantle right now, because I hear it from patients almost every single week. The myth is this: if I eat a balanced diet, I cannot possibly be deficient in a vitamin. That belief makes complete sense on the surface, and for most nutrients at most ages, it is even mostly true. But here is the reality. After age 60, your ability to absorb B12 has very little to do with how much of it is in your food, and almost everything to do with whether your stomach can actually pull it out and process it. As we age, many people naturally produce less stomach acid, a condition called atrophic gastritis, which means gastritis is simply inflammation and thinning of the stomach lining. B12 is tightly bound to the protein in meat, fish, eggs, and dairy, and it takes strong stomach acid to break that bond and release the vitamin so your body can use it. Think of it like a key that has to turn a very specific lock before your body can use it. In your 20s and 30s, that lock turns smoothly almost every time. After 60, for a large number of people, that lock has quietly started rusting, and the key can be sitting right there, coming from a perfectly healthy diet, and still never make it through. And it gets more complicated than diet alone. Two extremely common medications make this absorption problem significantly worse. The first is metformin, one of the most widely prescribed medications for type 2 diabetes, which research consistently links to reduced B12 absorption over long-term use. The second is a class of acid-reducing medications many people take daily for heartburn or reflux, because those medications work by lowering stomach acid, which is precisely the ingredient your body needs to unlock B12 from food in the first place. I want to be clear here. I am not telling you to stop any medication your doctor has prescribed. I am telling you that if you are on either of these, your risk for this specific deficiency is meaningfully higher, and that is exactly the kind of thing that should trigger a simple blood test, and far too often, it does not. And medication and stomach acid are not the only paths to this deficiency. If you follow a mostly plant-based or vegetarian diet, your dietary intake of B12 is already lower to begin with, since the vitamin is found almost entirely in animal products, which means there is less room for error if absorption is also reduced. If you have ever had weight loss surgery, particularly a gastric bypass, a portion of the stomach responsible for producing the acid and the specific protein needed for B12 absorption may have been altered or removed entirely, which can create a much steeper deficiency risk years after the surgery itself. Here is the part that connects directly to the title of this video, and the reason I wanted to make it in the first place. The symptoms of B12 deficiency, when they affect the brain and nervous system rather than showing up as obvious fatigue, can look remarkably similar to early dementia. Word finding difficulty, slower processing speed, mood changes, even irritability and mild confusion have all been documented in B12 deficient patients, and in a meaningful number of cases, correcting the deficiency led to real improvement in cognitive testing. I want to be careful here, because I am not telling you that dementia does not exist, or that every case of memory decline is secretly a vitamin problem. That would be irresponsible and untrue. What I am telling you is that this is one of the few genuinely reversible causes of cognitive decline that exists, and it is precisely the kind of cause that should be ruled out before anyone accepts a more serious label, because ruling it out is inexpensive, fast, and low risk, while missing it can mean years of decline that never needed to happen. There is one more trap I want to walk you through, because it explains why this deficiency slips past standard screening even more often than people realize. Your body uses another nutrient called folate alongside B12 to build healthy red blood cells. If your folate levels happen to be normal or even high, which is common now because so many foods are fortified with folic acid, it can mask the earliest blood count changes that would normally raise a flag for B12 deficiency. In plain terms, adequate folate can hide the evidence a doctor would typically look for first, which means the deficiency can sit undetected even longer than it otherwise would. Here is where the term drop I mentioned earlier becomes important, and I promise it is not as complicated as it sounds. The standard blood test most doctors order simply measures the total amount of B12 floating in your blood. But that number can look completely normal, sitting comfortably inside the green healthy range, while a significant portion of that B12 is inactive and unusable by your cells. Your blood test can say you are fine while your body is functioning as though you are not. The test that catches what the standard test misses is called methylmalonic acid, often shortened to MMA. Methylmalonic acid is a substance that builds up in your blood when your cells cannot properly use B12, even if the total B12 number on paper looks acceptable. When MMA is elevated, it is one of the clearest signals available that your cells are functioning in a deficient state, regardless of what the standard number says. This is the exact test I want you to remember the name of, and I want you to write it down if you need to. Methylmalonic acid. If you have unexplained fatigue, tingling, memory fog, or balance changes, and your standard B12 test came back normal, this is the follow-up test that can reveal what that first test missed entirely. There is a second marker your doctor may check alongside it, called homocysteine, which is an amino acid that tends to rise in the blood when your body lacks either B12 or folate to process it properly. Doctors often order this one together with methylmalonic acid because the combination of both results paints a much clearer picture than either number alone, and it also helps rule out whether folate is playing a role as well. You do not need to memorize this second term the way you memorize the first. Just recognize it if your doctor mentions it and know that it is working alongside the test you are going to ask for. I see this pattern constantly in my practice, and I want to describe it the way it actually plays out, because it tends to follow an almost identical shape from person to person. Someone in their mid-60s starts noticing they are more tired than usual. They assume it is normal aging, or maybe poor sleep, so they push through it. Months later, they start losing their train of thought more often, and family members start gently joking about it, calling it a senior moment. Then the tingling starts in the feet, usually first noticed at night, and it gets explained away as poor circulation or old shoes. Eventually, a standard blood panel gets ordered, B12 comes back within normal range, and the entire deficiency gets ruled out on paper, even though the person's cells are still starving for usable B12. This pattern can continue for years, sometimes even getting labeled as early cognitive decline, before anyone thinks to order the one additional test that would have caught it from the very beginning. Then, almost always, the shift happens the same way. A family member sends an article, or a different physician happens to ask the right follow-up question, and someone finally requests methylmalonic acid testing alongside the standard panel. And there it is, sitting clearly outside the normal range, confirming what the body had been signaling the entire time. Treatment begins, often through injections at first if the deficiency is significant, and within a matter of weeks, energy returns first, followed slowly by mental clarity, and finally, if caught early enough, the tingling and balance issues begin to resolve as well. I share this pattern with you not because I want to frighten you, but because I want you to recognize it if it applies to you or someone you love. The frustrating truth is that this entire multi-year cycle is preventable with one additional blood draw, requested at the right moment by someone who knew to ask for it. That is the entire reason this video exists. I want to be honest with you about something, because I think you deserve honesty rather than vague reassurance. Untreated B12 deficiency does not just cause tiredness. Left uncorrected for long enough, the nerve damage it causes can become permanent. This is treatable, often completely reversible, but the window for full reversal matters, and that window closes the longer this goes undiagnosed. I also want to explain honestly why this gets missed as often as it does, Because it is not because your doctor does not care. A standard office visit is often 15 minutes long, covering everything from blood pressure to medication refills, and ordering an additional specialized test requires a specific reason to justify it to insurance. Most physicians are trained and incentivized around treating conditions once they clearly appear, not around screening for a subtle absorption issue in a patient whose main complaint is feeling a little tired. Prevention simply does not generate the same attention inside a system built primarily to respond after something has already gone wrong. I am telling you this not to make you angry at your doctor, but so you understand why you may need to be the one who raises this test by name. Most physicians will order it without hesitation once you ask because it is a simple, inexpensive blood draw. The barrier is rarely resistance. It is simply that nobody thought to ask first. It also helps to understand that prevention rarely fits neatly into how the system is structured to respond. A 15-minute visit built around addressing today's complaint does not leave much room for a proactive conversation about a test that might catch a problem before it becomes one. Research consistently shows that screening and prevention receive far less structural support across medicine than treating conditions that have already become clearly symptomatic, and that gap is exactly where something like this can quietly slip through for years. If you take nothing else from this video, I want you to take this. The fog you have been living in, the tiredness you have started accepting as your new normal, the numbness you have been blaming on old age, none of that has to be permanent. There is a real, fixable reason behind it for a meaningful number of people your age, and you deserve the chance to find out if this is your reason too. I have watched patients get years of their own clarity and energy back from a single overlooked blood test, and I have also watched families quietly grieve a decline they assumed was simply aging, never knowing there may have been a reversible piece hiding inside it. I do not say that to frighten you. I say it because you deserve to know that asking one specific question at your next appointment could genuinely be that significant. If this is the first time you are hearing about this connection, please consider sharing this video with someone in your life who has been dismissing these exact symptoms as normal aging. This is the kind of information that genuinely changes how someone ages, and sharing it costs you nothing but might save someone else years of unnecessary decline. And if you have not yet joined our community here on the channel, this is a good moment to do that. It genuinely helps me know that videos like this one are reaching the people who need them, and it helps me decide what to cover next. I would love to know one thing about you before we continue. Type your age into the comments below. I ask this for a real reason, not just curiosity. The recommendations I give in the second half of this video shift slightly depending on your age and your overall health picture, and knowing who is actually watching helps me make future videos that speak directly to your specific stage of life rather than a generic audience. Here is something that tends to surprise people. Some research suggests that a meaningful percentage of adults over 60 have insufficient B12 levels once you account for both low blood levels and functionally inactive B12 that a standard test would miss entirely. That is not a rare edge case. That is a huge, mostly invisible population walking around every single day, functioning below where they actually could be. And research also consistently links higher rates of borderline deficiency specifically to the exact groups we talked about earlier in this video: people on long-term metformin, people on daily acid-reducing medication, and people over 75 where reduced stomach acid becomes even more common. If you fall into more than one of those groups at once, your personal likelihood climbs higher still, which is exactly why I keep coming back to the same simple point. This is worth one phone call and one blood draw to rule out. Let me bring back that finger test from earlier. If your fingertip tapping felt even slightly clumsy or delayed, I am not telling you that you definitely have this deficiency. I am telling you that subtle fine motor coordination changes are often one of the earliest physical signs of nerve involvement, sometimes showing up before a person even consciously notices tingling or numbness. It is a simple, free way to pay attention to your own body between doctor visits. And there is one more layer to this that almost nobody talks about, so stay with me here, because this is genuinely important. Even when methylmalonic acid testing confirms a deficiency, the treatment plan a person receives can vary wildly depending on the underlying cause, and getting that part wrong means the fatigue and fog can quietly return months later, even after supplementation begins. There are two broad reasons someone becomes B12 deficient. The first, which we have spent most of this video on, is reduced stomach acid and medication-related absorption loss. The second is an autoimmune condition called pernicious anemia, where the body actually attacks the specific protein needed to absorb B12 at all, regardless of stomach acid levels. This second cause typically requires B12 delivered by injection or high-dose methods rather than a standard oral supplement, because oral absorption may remain limited no matter how much you take. I know it is tempting to want a single simple answer here: one supplement, one dose, done. But the honest answer is that this condition has more than one root cause, and the right fix depends on knowing which one applies to you. This is exactly why I do not want you simply grabbing a random B12 supplement off a shelf and assuming the problem is solved. The right form, the right dose, and the right delivery method depend entirely on why your levels are low in the first place, and that determination should be made with your doctor once you have real test results in hand, not guessed at from a vitamin aisle. Let me explain the autoimmune version a little further, because the mechanism itself is fascinating, and it explains why the fix has to be different. Your stomach normally produces a specific protein called intrinsic factor, and B12 has to bind to that protein like a passenger boarding a bus before it can be carried through your intestinal wall and into your bloodstream. In pernicious anemia, your immune system mistakenly attacks either the cells that make intrinsic factor or intrinsic factor itself, which means the bus simply stops running, regardless of how much B12 is sitting in your stomach waiting for a ride. This is why injections work so reliably for this specific cause. An injection delivers B12 directly into your muscle tissue and bloodstream, completely bypassing the stomach and the missing intrinsic factor altogether. High-dose oral or under-the-tongue forms can sometimes work as well, since a small percentage of B12 can be absorbed through a separate passive pathway even without intrinsic factor. But your doctor is the right person to decide whether that passive pathway is reliable enough for your specific situation, or whether injections are the safer, more predictable choice. Before I give you the full action plan, I would genuinely love to hear from you in the comments. Has anything in this video matched something you or someone you love has experienced? And if there is a specific health topic you have been wondering about, one that keeps you up at night or that your own doctor has brushed past too quickly, tell me. Videos like this one often come directly from questions this community asks me. I read these comments myself, and more than once, a single question left below one of these videos has become the entire idea for the next one. So if something has been sitting with you, something you were told was just aging, or just stress, or just something you have to live with now, this is a good place to say it out loud. You might be surprised how many other people watching are quietly nodding along with you. Before I walk you through the plan, I want to prepare you for something that catches people off guard. If you do turn out to be deficient and you begin treatment, many people start feeling noticeably better within the first 2 to 4 weeks, sometimes even sooner. Energy returns, the fog starts lifting, and it becomes very tempting at that point to assume the problem is solved and quietly stop following up. I want you to resist that. Feeling better early is not the finish line. It is a sign the treatment is working, not a sign you are finished. Nerve-related symptoms in particular often lag behind how you feel overall, and stopping treatment or skipping your follow-up blood work too early is one of the most common reasons this deficiency quietly returns months later, sometimes worse than before, because the underlying cause, whether it is reduced stomach acid, a medication effect, or an autoimmune process, has not gone anywhere just because your energy came back. The first step: call your doctor's office this week, not someday, this week, and specifically request a methylmalonic acid test alongside your standard B12 level. Say those words directly. Ask for methylmalonic acid testing. Most physicians will order it without pushback once you name it specifically. If it helps, write the 2 words down on a sticky note before you call, so nerves or a rushed conversation do not make you forget the exact term once you are on the phone. The second step. If you take metformin or a daily acid-reducing medication, mention that specifically to your doctor when you request this testing, because it directly increases your risk and strengthens the medical reason to test. The third step. Pay attention to the small physical signals we discussed today: fine motor coordination, tingling in your feet, especially at night, and unexplained balance changes. Keep a simple note on your phone if you notice any of these, because specific examples help your doctor take the concerns seriously and act quickly. The fourth step. If your results do come back showing a deficiency, ask your doctor directly which underlying cause is suspected, absorption-related or autoimmune, because that answer determines whether oral supplementation is appropriate or whether injections will serve you far better. Do not begin any high-dose supplement or injection protocol without your doctor guiding the plan, since dosing depends entirely on the cause and severity of your specific deficiency. It is also completely reasonable to ask your doctor how long treatment is expected to last, since some people need ongoing injections indefinitely, while others only need a short correction period followed by a lower maintenance dose. The fifth step. Even while you wait for test results, consider supporting your stomach's natural acid production through simple habits: eating slowly, chewing thoroughly, and avoiding lying down immediately after meals. This will not replace medical treatment if a true deficiency exists, but it supports the foundation your body needs to absorb nutrients more effectively in general, and it costs you nothing to start today while you wait on an appointment. The sixth step. If you do begin treatment, whether through diet, supplementation, or injections, ask your doctor when to expect a recheck. Improvement often begins within weeks for energy and mental clarity, though nerve-related symptoms like tingling can take longer to resolve and, in cases caught very late, may only partially improve. Talk to your doctor before starting any injection or high-dose protocol, and follow their specific recheck timeline rather than guessing on your own, since guessing at your own dosing schedule can either slow your recovery or mask new symptoms that your doctor genuinely needs to see. The seventh step. If your doctor does confirm a deficiency and starts treatment, put your follow-up blood work appointment on the calendar today, not after you start feeling better. This single habit is what protects you from the pattern we just talked about, where people quietly stop paying attention once the fog lifts. The eighth and final step. Share this specific test name with one person in your life over the age of 60, especially anyone taking metformin or a daily acid reducer. You may be the reason someone else finally gets an answer they have been quietly living without for years. Before we finish today, I want to say something to you directly. Thank you for spending this time with me. I know there are countless things competing for your attention every single day, and the fact that you chose to spend some of it learning how to protect your own health means something real to me. If this video helped you see something about your own health more clearly, I would be genuinely grateful if you would subscribe, give it a like, and share it with someone who needs to hear it. Every single one of those small actions helps this information reach the people who are quietly struggling with exactly what we talked about today, often without knowing there is a name for it, let alone a fix. This channel exists for one reason: to give you the kind of honest, practical information I wish more of my own patients heard earlier in their lives. Being part of this community, even just by watching and sharing, is how we keep building that together. One video and one honest conversation at a time. And one last important note. This video is intended for general education and is not a substitute for individual medical advice, diagnosis, or treatment. Every person's history, medications, and lab results are different, and only your own doctor can weigh all of that together and tell you what actually applies to you. Please talk with your own doctor before starting, stopping, or changing any medication, supplement, or treatment plan, especially anything involving dosing or injections. Your own health history matters, and your doctor is the right person to apply everything you learned today specifically to you. I will see you in the next video, and until then, take good care of yourself.